Greetings everyone, Jeff Bourgeois here with San Juan Regional Medical Center. I'm here today to provide you with an update of the current COVID-19 status at San Juan Regional Medical Center, as well as what's going on around the state with respect to the global pandemic. First, I want to remind everyone to take advantage of the resources and informational updates we have on our website at sanjuanregional.com/coronavirus. There you'll find the latest statistics, as well as important phone numbers to access should you have any questions or concern related to COVID-19. Now let's look at what's going on at the state level. This slide represents the 7-day rolling average of newly diagnosed positive cases, region by region within the state, as well as the statewide average. That statewide average is the dotted blue line on the very top of the trend line. And you'll notice a sharp increase in recent weeks. That increase is really tied to the solid lighter blue line down below, and that's related to a cluster of cases, if you will, within prison populations in Otero County. Now the good news for the Northwest region is captured in that orange line. You'll notice that since early May we had a steady decrease. At the beginning, about 2 weeks ago, we started to see it increase again. However, it has leveled off in the more recent week to just about 60 cases or so on average per day. Next slide, this represents the rate of spread of COVID-19 throughout the various regions in the state. Now this is important because the phased reopening in our state is partly tied to the gating criteria of 1.15 or less as the effective rate of spread. You'll see our region, the Northwest, there at the bottom of the chart. Whereas 2 weeks ago we were at 1.10, below the gating criteria. We reduced that further in the subsequent week, the week ending May 31st, down to 1.06. And as I mentioned, we saw a little bit of uptick last week to 1.08, but we are still well below the gating criteria for the state's reopening criteria. Now let's look at what's going on at the hospital today. Our total census is 135. Of those, 28 are confirmed COVID-19 patients, and we have 7 additional patients that are what we call a patient under investigation, where we have a test result pending. So all 35 of those patients are isolated to our 4th floor, where we have the appropriate cautions and personal protective equipment in place to protect our caregivers as well as the patients. We have a total of 4 intubated patients today at the hospital, and all of those are on the 4th floor ICU and are COVID positive patients. So to date, that brings us to a total of 322 inpatient admissions we've had just since March, when the COVID-19 pandemic reached Northwest New Mexico and we saw our first inpatient admission. We have discharged 239 of those patients. Unfortunately, there have been 55 deaths related to COVID-19 at our hospital. Then it's a very hard number for us all to accept, but it is our reality. And I think it points to the importance of how seriously we all need to respect this virus. It can have severe life-ending impacts on individuals in certain high-risk populations. So we urge all of you to protect yourselves and those around you. And as I mentioned earlier, we still have 28 patients in-house. This graph shows our trend data, and really what you want to look at is that purple line near the bottom. That's the combined census, if you will, of our confirmed positive, as well as those patients that we still have under investigation. And you can see that for the better part of the last 3 weeks, it's been relatively stable. Decreased definitely from the peak, which was mid-May for inpatient hospitalizations, and it has just kind of flattened. We'd like to continue to see that curve continue to produce a downward slope, and if we continue to decrease the rate of spread in our community, we should see a decreased rate of hospitalizations in the very near future following that. So in summary, let me close. That within the last week, our Northwest region has seen a slight increase in the COVID-19 case rate, but we are well below the state's gating criteria. Hospitalizations in our area continue to be high compared to the rest of the state. However, they are well below our peak, which again occurred in mid-May. And we can't remind you enough to protect yourself and those around you. Wear a mask, wash your hands often, and practice social distancing. We've begun to reopen our outpatient clinic services and elective surgeries as part of the state's phased reopening. We urge you to seek the health care you need for those delayed visits and procedures. Also encourage you to get out and support our local businesses. This has been an extremely tough several months for them, and we want to support our local economy. So thank you again for all you do to support San Juan Regional Medical Center. Thank you to the caregivers on our team who are on the front lines battling this COVID-19 pandemic, which has impacted so many in our community. We couldn't have made it without them. We hope to get this part of the pandemic behind us and move forward to a brighter future very soon. Thank you and have a wonderful day.